episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome everybody again to another episode of our show with another fascinating guest who is looking to create a better tomorrow for many people around the world. And today we are going to be focusing on one of the top causes of death around the world, the leading cause from a single infectious agent. We're not talking about COVID, HIV, or malaria. We're talking about tuberculosis today. Estimated in 2017 that there were more than 10 million cases of active tuberculosis around the world, at that time resulting in over 1.5 million deaths. And, you know, we are still fighting this major pandemic with vaccines and drugs from about a century ago. And that's why I'm very happy that we're being joined today by Dr. Lucica Ditiu, who is Executive Director of the Stop Tuberculosis Partnership, a partnership whose activities focus on raising awareness about tuberculosis, advocating for greater commitment to and funding for tuberculosis prevention, treatment, and research. They have 1,500 partner organizations all around the world, including international, non-governmental, governmental organizations, and patient groups. The secretariat is located in Geneva, Switzerland, and is administered by the United Nations Office for Project Services, operational arm of the United Nations. Dr. Ditiu is a physician and a public health expert who has devoted her entire career to helping and supporting people affected by tuberculosis, especially those that are most vulnerable. She's a specialist in lung diseases, began practicing medicine back in 1992 in Romania, and has had a very fascinating career, all traveling around the world, dealing with this major issue. So all that being said, Dr. Ditiu, thank you again for taking the time to come on the show.
Thank you for doing this. You know, every time that you or any other colleague will focus on TB, I think any of us in the TB community at large should run and be available, because if there is something that TB needs desperately is attention, is bringing it to the level of the public to understand, what we are dealing with here. So thank you for doing this.
Absolutely. Absolutely. It's a pleasure. And, I'd like to just give you the floor for a couple of minutes, like we typically do. And just, if you could take a couple of minutes just to introduce yourself, a little bit about your background and how you became so passionate about this major pandemic in 2021. And I think that'd be a great way to start things off.
Yeah, so I come from Romania, and pretty, Romania was, and I think it still is a country that still struggles a lot with income, with politics, with economics, with education and health. And I come from a family of workers, and we didn't have any doctor in our family before, or any, as a matter of fact, any teacher or any, anyone that went to a higher school. It was during Ceausescu that I applied to university, and I am born in 1968, and in Romania we are called sort of Ceausescu's kids, because in 1967 he abolished, made an interdiction for abortion. So we have a large number of contingent of kids of 67, 68, 69. We are generations of a lot of kids, and now we are obviously not kids anymore. And that's why the competition to get a place in the University of Medicine was, and any other university, when I had to, was really tough, with tens of people for one place. And the agreement with my family was that I have one shot. So if I don't enter from the first one, I'll go back and be a worker in a factory. So anyway, I entered, I finished medicine, and then during the so-called these initial years when you try to get a specialty, I was in this in the Lung Diseases Institute in Bucharest, dealing with cases coming from all around the country, and interacting with some amazing professors there. And dealing a lot with TB, because TB was a lot, and it is unfortunately a lot. In Romania is the country with the highest number of TB cases from the European Union. So we are still not in a good place as a country, but at that time was even far more. So staying there and looking at, interacting so much and looking at the data and the files of people with TB that were hospitalized, you start realizing that first of all, they are not very much visited, that very often the fact that they have other comorbidities or other vulnerabilities, to say so, it doesn't make them very familiar with the staff and with everyone. That they stay a lot in the hospital. Like at that time, it was norm to hospitalize 2-3 months. People were feeling well after the first weeks, but that was the rule. So people were anxious staying there for so long in the hospital, thinking of their families and so on. So it's impossible not to become very sympathetic and to start loving them and actually trying to help more beyond what it was like your job description as a doctor. So that's how I entered into TB. And then actually at that time I was not even ever abroad. It started with a meeting in Istanbul in 1996, I think was my almost 30 years of age first trip abroad to a meeting about TB and lung diseases. And when I realized that between the clinic part, the clinician part, there is this entire realm of public health and international public health in which you try to help not just one by one, but actually in larger groups. So that's how it all started, to be very honest. And here I am after more than, let's say, 20 years, mainly, and focused on TB and trying to help people with TB.
And you did a marvelous job at it. I just want to let you know. The World Health Organization has declared TB a global health emergency. We talked about some of the numbers at the beginning, over 1.5 million deaths a year. And I want to put a lot of this in perspective, because when I look at the main vaccine, BCG, and you go back and you see that it was first used in 1921, and to put that into some perspective, that was the same year that insulin was discovered, and it was years before penicillin existed. To give an idea of what we're talking about, we're also talking about antibiotics that were discovered in the 1940s for this disease. These are the mainstays. How did we get here? I mean, the year is 2021, I believe. What are we missing here? Why are we dealing with a 100-year-old vaccine and drugs from, the first half of the 20th century?
Yes, so you are spot on, and just to say what made me one way annoyed, but the other way hopeful, and I'll go back to the point that you made, is that with COVID, it showed that it is possible. You know what I mean? It is possible to have a huge amount of funds mobilized over a short time, and it is possible also to develop a vaccine in an unheard of amount of time, by being able to do things in parallel. Not to wait phase 1, then wait phase 2, let's wait then phase 3, but go with things in parallel and try to understand and put, of course, another thinking in place. So on one hand, I was annoyed that how come that this is possible? For so many years this was possible and we never got at this stage for TB. But on the other hand, it gave me hope, because I said, okay, so it's possible. So what we need is to continue the pressure. We also, I really hope that the team of German researchers, German-Turkish researchers that worked for the Pfizer and Moderna Pfizer vaccine will be able to look at using some smart ways for a TB vaccine in a similar way. But your question was not really this. It was a question like, how can we be in the year 2021 with a disease that is with us for so long time, that the tools that we try to use for this disease are 100 years old vaccine and 50 years old or 60 years old drugs? And my answer is it has a double part. One is related to the fact that the people with TB are very different than even if you say now the vast majority of people with TB are very different than, let's say, the people that have COVID. You know that even today that we speak, me and you here, 2nd of February 2021, TB is the major killer in the developing world, is not COVID. If you extract from the COVID numbers that we see every single minute on the screens of TV, if you extract the number of people that passed away in US and in all the big north, let's say, in the developed world, the developing world is actually being killed by other diseases, and TB is one of them. So first of all, I think TB, because it's mainly focused in the parts, of the world that are, and among people that are the most vulnerable, it was always somebody else's problem, and it was never in the face or in the attention of the of the funders and the big donors to create the movement or the noise around them for the enough funding. The second part, which is not the first and the second in terms of like what is more important than the other, is a chain of things, because the second one is related to the fact that TB is an old disease, so people got used with it. It was also all the time perceived as a medical disease, so it's like a medicalized approach in which it's the problem of the doctor and the nurse. It's not the problem of the entire society. And many other parts of the governments were for a long time not engaged at all when they should have been, That's why people are not educated about it. That's why in the medical school and in the nursing, for the nurses, it's just a small part of a curricula, when in countries where TB kills the most, TB should be an important place to go. The migration part, all TB that you have in the health place, because TB is airborne. It's insane. It's airborne. So as far as you breathe, everyone is at risk. And in spite of that, it was perceived as a long time just as a medical issue. And that's why doctors and nurses were doing their best dealing with their patients, but without having the openness to really interact and discuss with the others and bring the attention as needed. But and the third piece is the other one, which is linked somehow with all of them, is that you see, we have, in a way, if you look at how HIV evolved and how COVID evolved, HIV was a demand from people affected. It was a large movement of people that were infected with HIV/AIDS, requesting the better tools, more money, research. It started and sparkled in the big north, with large gay communities getting together and creating a huge movement in which researchers, doctors, nurses, and other groups joined in. So it was an entire society movement. With COVID, it's actually not necessarily just the affected ones, but it's more of the government movement that is created because of the fear. And TB never had either, okay? It's linked somehow because we never had the movement of people to demand, people should be up in hands and say, I don't want to take any more 50 or 60-year-old drugs. This vaccine is a joke. So it is a joke because it's a joke for adults. It's a reality. It's very useful for newborns and infants for very difficult forms of TB in endemic countries, but for adults, it's not helpful. So the third kind of, or the link between the two aspects that I said, the lack of attention and funding, and the fact that it's a medicalized, is the fact that people affected by TB for a long time were not engaged, didn't feel like they are part of, were not encouraged to come together to demand the best for them. So we are getting some road into that over the last years, 3, 4 years, 5 maximum, but we have a long way to go.
And so take us from there now. Introduce us a little bit to Stop TB, a little bit of your relationship with the UN, and then please take the floor and talk about what obviously you have a lot on your plate, a lot of organizations you work with. What are you most excited about in 2021? Is it new drugs, is it vaccines, or is it some of these other tools that we're seeing in terms of digital health, education? What are the priorities for you? Yeah.
So I'll go briefly to tell you, just to share a bit what is Stop TB, and then I'll go into the last point that you made, which is actually the exciting one. So as Stop TB Partnership, we are a team of around 90 people. And as you know, and we grew up a lot over the last years. Actually, we are now having more than 2,000 official partners worldwide. And
Nice.
we are hosted by a UN organization, as you said, UNOPS. But what I would like to say about Stop TB, and I'm very proud of, is we have a very an amazing board that gives us, direction and supports our vision and so on. And it's a very solid group of people that care about global health and TB and people most and foremost. But what I think we are is a very agile team. And I think we are in a position in which we combine two things that are not very easy to find. We combine the fact that we are a UN, so we follow all the rules and regulation of United Nations, and therefore we work with the UN offices in the countries. We interact, obviously, our closest partner is obviously WHO, and obviously, but also we work with UNOPS, UNDP, and all other UNs. So we combine in a way, UN, for a long time, people are thinking about UN as a big animal that is a bit difficult, very bureaucratic. That's what you hear from, people on the street if you speak about UN. But UN has some standards that should be followed, because it gives with that trust and solidity. So we have that. But on the other hand, we manage to really use energy and use some risk appetite that exists in UN and so on, to have a sort of NGO-like attitude in which we try to push the boundaries and we take more risks. And you asked me, and I want to say here something for us all along. I think if we are unable as structures, and not just Stop TB, but in general, to be more risk, to increase our risk appetite and be much more agile, organizations will not survive. COVID showed us that we are all in a world that is interlinked, that it's very easy to destroy a lot of what we gained. So if you are not able to adjust and adapt and quickly change your structure and your approaches to become more flexible towards what is happening, you will not be able to to survive. So that's why as Stop TB, I think we are really combining at the best these two parts, and that's why we are able to push some innovations in the TB space, some new thinking in the TB space that actually can be taken forward by others, much bigger, much more important and advanced. So that's Stop TB, and it's great that we have also people in some regions and people in each region, and we have some people in countries as well that we are. But the most important is we work with civil society and communities, and we have amazing networks at the global, regional, and country level of survivors that are giving me a lot of hope for the future in terms of raising the voice of TB on what we need as a community. So you said why I'm excited for 2021. So to be honest, I think I am worried for 2021, but also excited. I'm worried because, when 2020 was in November 2020, in December 2021, everyone was like, let this year finish and let's start in 2021 and it'll be so amazing. And actually, a lot of things are not as amazing as we thought, and the bottlenecks still continue. Sure. But I am excited for TB for 2-3 things. One is, again, not in a particular order, like to say this is the most important or not. One is the fact that, as I said, I feel that people affected by TB and civil society and communities are raising their voices and expectations as never before. Last year, we supported our constituencies to develop a report called Deadly Divide that actually compares it's a very in-depth report led and organized by the civil society and TB survivors that compares the United Nations targets on TB that should be achieved by end of 22 versus what is happening, and making this division between what is on the paper and looks good and people commit and what's actually happening in reality. It's indeed a deadly divide. So I feel, one of my hopes is the fact that when I started in this job in Stop TB Partnership, I was, it will be 10 years in May. There was almost not at all a civil society platform. While now, not only that we have, but you are very happy when what comes out of your work and of partners' work is better than you. We have these amazing people at country level and regional level that are up in their hands and will be able to even continue this in demanding more for TB. So that's one of my hopes this year. Another big hope is what you said. In Stop TB, in spite of people initially being like, okay, these people are not so big, they are a bit unusual, so let them be. We use this time to actually push a lot of innovations out of the door, especially artificial intelligence and digital technology. Okay. And to be honest, there are very few places and organizations in the world that have as much as hands-on knowledge that we have on using digital technology and artificial intelligence in health. Okay. Because what we did, we funded through one of our teams that it's called TB Reach. We funded country programs or partners at country level to use different tools to see how it works. Because it's very easy to say, okay, how do you do an X-ray? In my time, X-ray was a big machine in a room, in a hospital, with all these very half-meter thick walls, that the radiations are not coming out. When an X-ray was happening, the nurse was coming on the corridor saying, X-ray, run away. So people were running away. X-ray was happening, we were walking again. Now, there is an X-ray portable, as big as this size. You can take a selfie with it. I'm not making this up. You put this X-ray, and then you don't need even to have, you don't need to do more than the photo, because then through, artificial intelligence platforms, whatever, is transmitted to a doctor that can read it. You don't need to be more than somebody who knows where to press the button and how to position it. And then it goes automatically to a doctor, and the doctor is aware how to read it, and it turns back the diagnosis because he can see the photo. So that's for one example. The same is, you see, more and more, I think, and COVID shows that, but we in TB used to do that before, is if you want to find everyone which is infected with a disease and do a proper, you see, COVID is doing a lot of the things that we were learning in the school as TB, contact tracing, right? So it's very difficult. And when you take this, everyone that is exposed to an airborne disease, and you say, okay, you are the principal case, but you have some people you are in touch, you all should be checked. Yeah. So to do that properly, it's very costly. It's much easier to bring the check closer to the family or to the group where you have the contact. So the closer you come to the patient or to the person sick or suffering with the diagnosis or the health system, the better will be. So the future should be a very individualized, tailored approach in which I don't have to run after the diagnosis, after the doctor or the treatment. This should be closer to me in such a way that I'm quicker in approaching, is friendly user, is not threatening, and it makes me approaching it. And one way which we are pushing now is to show vehicles, like little cars in which you have diagnosis in a car. You can have diagnosis in a suitcase, because if you have these tools miniaturized enough, you can have a lot of tests done. But in a little car, you can have a lot of stuff. So you go in a community and you can do everything from TB, HIV, cardiovascular, you can test eyes, you can do, diabetes, you can do a lot of tests that are actually coming to the community, and it's much more affordable and easier. And then the next step is you work with community workers to follow up on what was diagnosed, and people follow treatment. So that can be much easier, and you don't need the need to come with all this tertiary care and big hospitals closer to the people, or people to spend all their money forward going to a hospital to get properly diagnosed. So to make a very long short, my second hope for this year is related to the fact that digital technology and artificial intelligence will help us in TB. and us in Stop TB, we will share all this knowledge that we gathered over years when nobody was even looking at X-ray mobiles and stuff. People were like, okay, that's crazy. We funded projects that were using the drones to deliver treatment. And that was, I think, 5 years ago when people were not even thinking about that. So that's my second hope. And my third, to be honest with you, is related to the fact that this noise about research and the fact that it's such a discrepancy between two airborne diseases like TB and COVID, but still for COVID, money came. There was no issue with the timing to find a vaccine. While we in TB, you will be shocked to hear that we have some vaccine candidates for TB as well. We have, I think, between 10 and 14 candidates in different phases. It took us almost 18 years to arrive here, 18. And if you say, okay, you are here now, when are these vaccines ready? We have hope that maybe one will be available in 2027. So, you hear this, you are like, forget about it. Go home, madam. Go home, and all the vaccinology in TB, go home. Because if you tell us that this will be something available in 6 years from today after you worked 18 years to arrive in this stage, and that is feasible if the money will come, so there are if, it's not that, okay. So my hope, and as you said, this year is 100 years from the BCG. So I really hope that we will raise some hell, to be honest with you, for people to realize that there is possibility to use our imagination and funds to create a vaccine much quicker for TB as well, who is an airborne and who, by the way, TB just continues. You have COVID, is hitting us back and forth and disturbed our life dramatically, but TB remains there. It's like, okay, I'm just continuing. I don't care. I will actually go up because it's even worse, but I'm not going down. You guys continue with your COVID and so on. I'm staying here. So my hope is that maybe this year we are able to make the case for research for TB much stronger than in other years if we are united as a TB community.
Thank you for that message. It's very important. It's amazing. Really amazing listening to these timelines and comparison. But since the last time you and I chatted, after the last time we talked, I watched several shows. I think you were doing a bit of podcasting yourself, and you had several sort of celebrities on from various sort of TB hotspots, rappers and actors and other folks from Burkina Faso and Cambodia. I forget where everyone was from, but you are bringing sort of the celebrities into the advocacy part of things, which is extremely important because of this, celebrity-oriented world we live in. Are you still doing some of that? And how did that all help in terms of, once again, raising awareness at the ground level?
Thank you for that. Yes, I'm trying anything. Between me and you, I will try anything. You'll tell me, dress in purple and go on the street and give flyers because that will make people aware. I'll do it. Whatever we do, because people are not aware about TB. That's the problem. People don't feel the scare of it. And that's why now, we asked for masks in the hospitals, at least to be used for ages. We have campaigns with using the mask. We have friends in South Africa called TB Proof. We had tons of photos and so on. It didn't take off at all. So we are also not a disease that any celebrity from Hollywood or anyone amazing wanted to take on, between me and you. We tried that as well. Funny or is not funny. Depressing enough, there were some of these famous people that had TB, but they don't want to remember and they don't want to be associated. So when we went and said, we don't want money, we just want you because you are so important. Can you speak about TB because you had it? It's like, no, I don't want to remember that part. So anyway, we didn't have anyone famous at global level. To be honest, it's also, I'm not that, excited about it because somebody that we perceive as famous in the big north, like, oh my God, George Clooney or, an Angelina Jolie or Bradley Cooper, To be honest, for a Pakistan person affected by TB or for a Rwandan person affected by TB, it means zero. Right. So we said, who who will mean something for these people if there will be an example? And we said the celebrities in their countries. So that's how I said these people are a million times more important than this global, sexy, whatever, because they are amazing, sexy, and amazing as well in their countries. So yes, we have 12 at country level in different high burden countries. We embark into engaging with others, and we'll continue this kind of dialogue as well. And what is more amazing, so, you know, you saw, and you very well said, from rappers to TV speakers, from actors to ex-sports champions, the national coach of, I think, was Cameroon or Cote d'Ivoire national football team was there as well. And and you know, it's so, I'm so grateful for them because they do this for free. You know, we don't have a Stop TB, the resources of a UNICEF or others that are really into these champions and, you know, have financial resources for that. So everything to even support them in any way, even to produce for them some leaflets or something, it's everything is volunteer. It's, can you help your people be better? And we didn't have any of them saying no. And more than that, because we are somehow engaged, they are continuing on their own now at national level. So they work with our partners there. In some countries, we have national Stop TB partnerships that, again, we have a very light touch of engagement with them. And together with civil society and journalists, we created a bit of nucleus, celebrity survivors, journalists, and the technical people. And they are having conversations about TB, and they are doing different either articles or little events at national level to push forward the agenda. So we continue. We have actually some amazing lady from Nollywood in Nigeria that, you know, she actually came forward and said, I know TB is a big issue in Nigeria, so I want to help. So, as you saw, you know, we continue with what we have, and hopefully we will end up in at least our 40 highest burden countries to have a sort of this kind of champion to take forward. Amazing people, really amazing.
Outstanding. And you could also dress in purple and go out in the street too. That'd be cool as well.
Yeah.
But
yes, I will do that for sure.
Well, Lucia, it's always wonderful talking to you. I don't want to take a lot of your time because you're so busy, but I just really want to thank you again for everything you're doing. Thank you for taking the time to come on the show to spread the important word about this. We'll help you get the word out as much as possible. For everybody that's going to be listening to this particular episode on the podcast network or watching or on the YouTube, you're listening to Dr. Lucica Ditiu, Executive Director of the Stop TB Partnership, focusing on raising awareness about tuberculosis, advocating for greater commitment for funding, for prevention, for treatment, for research, to this truly global health emergency, 10+ million cases, over 1.5 million deaths every year, an extremely important topic. Luchita, I thank you again for coming on the show and sharing your wisdom, and, you know, thank you for everything you do for this incredible pandemic. And as we say, thank you for making the world, you know, creating a better tomorrow for everybody via your initiatives. It's very inspiring, and just once again, thanking you.
Thank you so much, and thank you for doing this. The more we speak about our health and our future, the better we'll be. But the more genuine we speak about it, and not, you know, the usual bullshit that sometimes is happening. So thank you. Thank you.
Absolutely.
Take care.